What's up? We're going to go through an Iastm treatment using the HG Pro. It's a tool made by Hawkers. So, benefits for this type of treatment is improved blood flow, improved tissue mobility, decreased pain, although you may have some pain upon palpation, so like some tenderness upon palpation, but decreased pain with movement. We're going to use Chris today as our subject. I know Chris has a lot going on in his neck because I treated him once already, so we'll see what shows up as we go through.
Hey Jeff, can I ask why would somebody look for a treatment like this?
Depends on what you have going on. I mean, most people have soft tissue dysfunction. Most people have stiff neck. Most people have tight pecs, tight biceps. Especially if you work at a desk all day, just the positions you're in throughout the day can cause changes in the tissue. I love this tool just because of the quality of it. The bevel is pretty sharp. It does make it a little more aggressive, but also more effective. This surface of the tool is probably the most gentle. So you start here, you end up progressing through all the different surfaces of the tool, depending on the presentation and what you're trying to get at.
What's the stuff that you just put on his neck?
So that's pure oleant. The name of the company is Pure Oleant. It's an emollient. So basically it's just a cream that reduces friction between the tool and the person that you're working on. You would never want to use this tool on somebody without something to reduce the friction and feel horrible. I like this company's emollient just because it's certified USDA organic. It's made with coconut oil, beeswax, lavender, a bunch of other stuff.
Lavender.
I've tried Hawk Grip's emollient. I'm not a fan, I gotta say. It smells great for like the first 15 minutes because it smells like cake batter, but after that it gets a little nauseating. My opinion. It's also not organic. There's some other stuff in there. So if you take a look at Chris's neck here, you get a close up. This area of redness right here, that's called petechiae. That's when small blood vessels start to burst. That's an area that he has a lot of dysfunction. That's an area where he has decreased blood flow, probably some adhesed tissue. So really it's like type 1, type 2 collagen fibers. The fascia really is kind of bound down in that area. It's my job to get that to break up and get additional blood flow there. This particular treatment does a really good job at restarting a healing process that may have stalled out. So if he had an injury here or he had some dysfunction here, not stalled out and he hasn't been getting blood flow to that area, it's gonna stay that way until you work on it. The first time we did this, his neck was almost purple. Like his whole neck was purple.
I think I still got a picture from that.
Yeah, we could probably post that picture. Now, just this area is kind of lighting up for him. The rest of it is trapped. And some of the scalenes along the side, well, I lied. Some of the scalenes are gonna light up too.
So would you say it looks worse than how it feels?
It looks much worse than how it feels. Although you should probably ask Chris.
Chris, how's it feel, Chris?
There's a noticeable change. It's actually, this is much better than the first time around. So part of it is getting comfortable with what's happening, and now it's focusing in on where the dysfunction is.
So for this particular treatment, like I said, you always start with this surface of the tool because it's the most gentle and kind of allows you to assess what's going on in the person's body. I'm really not doing anything but uncovering what's already there, just making it more apparent. If he had nothing going on at all, the presentation would be this nice even red that you see a little bit lower onto his trap. And you can tell he has two areas of dysfunction, one here, and I haven't searched up here yet. But that's just with this surface of the tool. That's
So those are more assessment sweeps, right?
Yeah, for sure. These are more meant to assess what's going on. We already had stuff showing up during the assessment, so as we progress through the treatment, let's get a little darker, get a little more red, and then we'll get a little more petechiae.
So if you're somebody who came in and received a treatment like this, what are they doing afterwards? Because you said that it increases blood flow and helps with mobility. Are they going to do something on their own, or they come in? Like, how many times do they see you?
Yep, so there's always carryover. For most cases, something that's not severe or acute, I've resolved most of them within like 3 to 5 treatments.
Mm-hmm.
As far as carryover, whatever tissue that we mobilized, whatever range that we gained from that mobilization of the tissue, you're going to have to continue to stretch that tissue and then work within that new range, gain strength and really motor control within that new range. It depends on the area. For Chris, he would stretch his neck, There are exercises that he could do for his neck, but I would really more so have him focus on his trap. How you feeling, Chris?
That actually,
A little tender?
it's a little tender, but much better than the first time around.
Almost done. So as far as this treatment goes, for most areas of the body, you're going to try to move the tissue or mobilize the tissue in every direction. So far it's just been top to bottom, bottom to top. A little bit later as we progress, we'll start moving. Really it's going to be midline to lateral to his left. Whenever you're working near the spine, you always want to try to move the tissue away from the spine. You never want to move towards the spine. Reason for that being is that typically when tissue gets tight, it ends up adhering closer to the spine and not moving. So you kind of just be working against yourself. You really want to get the change you're looking for. His neck is looking a lot better than it did the first time. You notice that the petechiae kind of started in the very beginning with the assessment sweeps, but it's not getting too much worse. The first time we treated his neck, it pretty much turned purple. Which is unusual, but man carries a lot of weight on his shoulders.
Put the whole team on his back.
See right here? I would say this area is a bit more dysfunctional. If you look at the change in color, this is a darker red to purple than this is.
Where you're touching with that point that you were just
Here.
working on, yeah,
Yep.
that feels like I have the most. My tension is sitting right there.
Yeah.
That's the feel good spot.
I would say that's probably your levator. It doesn't feel like a scalene. There's different thoughts and ideas from people who practice this on how much pressure you should use. I say use as much pressure as it takes to get change. You really don't want to lay into somebody, especially if it's their first time.
Or as much as they can tolerate, right?
Yeah, as much as they can tolerate. Even if they can't really tolerate it, if I need to get change, I'm going to lay into them a little bit. Kind of all depends. The goal isn't to hurt the client, it's just to get some change. Alright, to finish the treatment, you always want to try to add some motion along with the soft tissue mobilization. So since we're trying to get this area to open up, we're going to have Chris side bend away as I kind of sweep downward. Go ahead, side bend away. Good, back up.
I'm trying to get as far as I can.
As far as you feel comfortable into that range. Got it. I'm going to do my best to try to keep his left shoulder depressed and get a good stretch through all that tissue. This would be more for the levator. We're going to go through and do it again. Make it a little bit more specific for his cervical paraspinals. That knot that's a little closer to the spine. Good, pause right there. Get him look straight down. Yeah. Go again. Up. Go. So we'll wipe that off. We'll do a quick assessment of his neck, shoulder mobility. We'll just compare the right shoulder to the left shoulder by having him bring his arms overhead. We'll have him side bend and rotate to either side of his neck as well. So you can come back here, kind of behind me. Go ahead and have a seat, stay right there. If you look, you can see that the right shoulder is just a little bit more elevated than the left, which is a good thing. We made some change on the left side. Chris, you bring both arms overhead. If you get over to Chris's right side, you can probably see, or his left side, whichever.
Definitely feeling more free on that left side.
Left side feels better. And you can see the distance between his shoulder and his ear on the left versus the right, so he definitely has more range. He has a bit more scapular mobility, just because we loosen up the top portion of the strap. Arms down. Side bend your head to the right. You see the range, the distance between his shoulder and his ear. Other side. You can see that there. You can do that again. You almost see how this tissue moves a little bit more and stretches versus the other side. And to the left, you can see that really doesn't even move at all. So he's carrying a lot of tension on this side too, which means we'll have to go through and do that. So that's it really for the treatment. As far as the tool goes, this is probably the best tool I've used. I've used this one as well. This is made by the Pure Olean Company. It's nice, it's much more gentle. The bevel is really soft. This one, I feel, has a greater level of sensitivity as you're going through. I can feel much more of what's going on the person that I'm working on through this tool than I can with this one. This one's made of surgical steel. This one, however, is not. This is also a little bit heavier and it feels better in your hand. That's it. It's HG Pro.